Welcome back to Great Day, Texas, or Great Day, Houston. All right, I used to do Good Morning Texas in Dallas. We're in Houston. Telemedicine has been around for a while, but now that many of us are doing more things virtually, it makes more sense. It can also be more convenient and a better use of time for both patient and doctor. Dr. Paul Shupe with UT Physicians explained how this modern day house call is especially useful in the era of COVID-19.
Dr. Shupe, telehealth has been out there for a minute, but I think a lot of us were reluctant to try it. Old habits are hard to break, both patients and doctors. But the great thing about this now is COVID-19 has actually forced us into it a little bit. It's efficient and it's convenient.
I'd agree with that. I think this pandemic has really pushed us kind of to the edge for technology. Initially, when this started and we had to start closing our clinics to anyone except for urgent fractures or things, we were coming up with ideas of what we could do to maintain contact with our patients. And telemedicine really has put us at the ability to see those patients and continue healthcare, which is well needed during this time. And it's really a resource that I think that was out there, but many of us weren't using because it was new and we just didn't want to change what we were doing.
And when you're sick, the last thing you want to do is get in the car and go someplace. So if you don't have to, that's great. It's convenient in so many different ways. You're not finding a parking space, you're not traveling. And for doctors, I would imagine it condenses your time that you can actually probably meet with more patients.
It really does. At this point, now that we're sort of getting back to normal in our office, we still have a big role of this telemedicine. It is convenient. I don't have to leave my office. I can be working on notes and at the same time put that aside for a minute and get on my computer and have a face-to-face meeting with my patient, whether to review an image or if they have questions about a surgical incision on a surgery that was done recently. It's convenient not only for me, but also for those patients who, like you said, don't have to leave their homes, battle the traffic or the parking, and have a quality encounter with their healthcare provider.
And just go over kind of some of those things that you talked about that you can actually deal with in telemedicine versus somebody having to come into the office.
Great. So things that we typically deal with, so MRI reviews or CT scans or sometimes x-rays that were obtained in the emergency department can easily be done via telemedicine. We have ways to share our screen with the patient, and so we can review that image in their presence without them being with us in the office. Certain post-operative exams, like I mentioned, checking someone's incision, as long as sutures don't need to come out, actually talking to patients about their motion. As we do this with video, they can actually show me just as well by video as they could in the office what they're doing with their particular extremity or the condition that they have. These are convenient things that we can do right now. We're actually working on the possibility, if we get the opportunity to play high school sports again in the fall, which we hope to be able to do, to implement this for some of our training rooms and actually sideline care. When we're physically at one game, we can virtually be at many locations at any particular time. So these are some of the things that we're actually using telemedicine for. During the pandemic, when we were trying to limit our access, or not our access, but actually our contact with patients in the hospital for fear of us bringing something to a patient or them giving something to us, we were conducting telemedicine visits with our inpatients when we had consultations there. And that's something that we plan to continue to use in the future.
And I would imagine some things as simple as just needing a prescription. That way you're not having to, again, drive all the way down, sit in the office, tell you what the deal is. You can just basically take care of it there.
That's correct. With so many different laws that we have for prescribing, whether it be a narcotic or certain medications, a face-to-face encounter over telemedicine actually counts for that. So that is absolutely right. And the patient is also reassured that they're seeing somebody and talking to the provider, whereas our nurses used to do that, and they'll continue to do that, but now they're actually getting to talk to their healthcare provider.
All right, Dr. Shupe, with that said, we can't just like call you up or log in and say, hey, doc, can you check this out? There is a process. How simple is it to make the appointment? And there are some people who still kind of are unsure because they're not that tech savvy. It's easier today, isn't it?
It is easier today. We are making it more easy and more accessible for our patients. And so it can be as simple as making a phone call to our office. They'll give the option to do a telemedicine visit, and they'll be sent a link via email to arrange that. It can also be done online if you are searching. A lot of people search online for it, and so there are links on our websites that allow someone to just click and schedule through like a schedule type now application. And so we're trying to make it as simple as we can, whether it's point and click or whether it's actually talking to somebody on the phone to get things arranged for the patient. So it's relatively simple, and I kind of say if my parents can do it, so can yours.
All right, some patients will still have to come in. They might be hesitant, though, because of COVID-19, of who they'll be exposed to. You've gone above and beyond to take care of that.
We have. So at UT Physicians and UT Ortho specifically, we have taken those steps. So each night after the office closes, there's a deep cleansing that is done on all frequently touched surfaces. Each of our staff members are in masks. When the patients come into our clinics, they are screened and they are also given a mask. We ask anyone who's had a fever is really not being admitted to clinic, but we're seeing them via telemedicine. But we are taking the necessary steps and procedures using PPE to keep patients safe and keep our staff safe and comfortable in that work environment.
Well, Dr. Shupe, thank you very much and stay safe.
Thank you. Thanks for having me.
And for more information on UT Physicians and to schedule an in-person or telehealth appointment, call 888-4UT-DOCS. That works out to be 888-488-3627 or visit utphysicians.com.